It's a pattern on the streets.
I'm an addict, and my family doesn't condone it.
Drug use, honestly.
Drug use, a common coping mechanism for many who are homeless.
It was just something to do because I was bored.
And turns out getting clean in Portland isn't easy, regardless of if you're homeless or not. Take it from Erica Shear, who has a house, a full-time job, and struggles with addiction.
Drinking became much more of a crutch.
She started drinking when she was 12.
Yeah, there's that.
She's now 46 and wants to quit. She tried on her own last month, but ended up in the hospital.
My tongue, I still have to hold it in. I almost bit off half of my tongue. I had 3 grand mal seizures in one day because I quit alcohol.
Now she's looking for professional help and was dropped off outside Fora Health Tuesday morning in Southeast, one of the 2 large-scale detox treatment centers in the city that accepts walk-ins.
I tried to go yesterday to another one. I wasn't able to be seen. And then tried again today, wasn't able to be seen.
She was one of about 20 people in line. She says they only had space for 3.
Horrible. I just actually walked out of the rehabilitation center after waiting and just said, I just need help. And to not be able to get that, yeah, very deflating.
It takes enough courage just to show up to these places, and then when the help isn't there, it's definitely disappointing.
Jimmy Sanchez was also turned away. He's been trying to get into detox now for 2 days.
Oh, they just took my information and then called all the names of who they were accepting, and then whoever they didn't call, they didn't have a bed for today.
Well, it's awful. It's awful.
Jessica Gregg is Fora Health's chief medical officer.
One of the earliest moments of distress of the day is when there's a long line and there are 6 open beds.
Starting at 7:30 in the morning, 6 days a week, people ready to detox line up outside these doors. Fora just increased their number of beds from 16 to 24, but it's still not nearly enough. They also need more staff.
Even just talking about it, I'm almost choking up because it doesn't get easier.
Jennifer Hartley works with the walk-in patients. The majority are addicted to fentanyl or alcohol, and nearly half of them are homeless.
We see people for whom this is their very first time seeking any kind of treatment.
She prioritizes those who keep showing up, even if there aren't available beds. But it doesn't make turning them away any easier.
We work to admit anywhere from 11 to 14 people a day, sometimes more, and we turn away about the same amount.
Amanda Risser works at Hooper Detox Center in North Portland, the only other large-scale treatment center offering walk-in detox services like Fora's. There they have 55 beds and help 2,500 people a year. That's about 260 people a month.
And every month we are unable to serve about the same amount of people due to space considerations. We just simply don't have enough beds.
I think, nationwide, we're looking at ways to expand access to treatment, and I think it can't possibly happen fast enough.
But for those struggling with addiction, time is of the essence.
I just couldn't go on anymore. I was dying.
Over a year ago, Kate Platty slept in her car across the street from DePaul Treatment Center, which is now Fora Health.
I was addicted to meth and benzos, and I just couldn't go on anymore. And I hit my knees and cried out to God and said, God, if you're real, can you please just get me sober or take me to heaven in my sleep tonight, because I can't go on another day like this.
At 18, she left the foster care system and her life spiraled out of control.
I met a guy who it didn't feel like homelessness. It just felt like we'd party every night and stay at a different person's house. And then in between, we'd stay in our car. And I had never been homeless before, so it felt like an adventure. And eventually, it wasn't fun anymore. But at that point, I was trapped.
Locked in a lifestyle that eventually changed when a rehab bed opened up.
And then it was glorious. I slept for 5 days. The food was great. The nurses were so nice. I was just so happy to be here and to feel like I was safe. It wasn't survival anymore.
But for people like Erica, she's left waiting.
Tomorrow, hopefully we can be seen.
And yearning for the day she can be set free.
I don't know. to not have to pick up a bottle, to not spend my time going to the liquor store in the morning because I have the shakes, to not go to a bar at 7 a.m. because I have the shakes.
Now, both of these detox centers say they're almost always able to get people in if they come 2 or 3 days in a row. And a typical stay is 3 to 5 days. After that, they connect the patients with case managers to help keep them on the road to recovery. Their goal is to never discharge people back into homelessness. But given the challenges they face, that's not always possible. Brittany?
Such an important look into this issue. Thank you, Blair.